ever.
I can't imagine going through this all day long. Please welcome Dr. Youn to the show. Thank you, Doctor, for being here. You are Catherine's, I shouldn't say you are Catherine's plastic surgeon. You are a surgeon that has done some work for Catherine.
Yes, she has gotten some rosacea treatments at my office before, amongst a couple other minor procedures.
And let's talk about what rosacea is. You have a tendency to flush, correct?
Yes.
So you get bright red.
Exactly.
Some of the things to take care of the flushing has been, well, I don't know. I think a little extreme, but you had to do what?
Well, actually, rosacea is a problem that can actually get worse, and it's a medical problem that is best treated with laser treatments.
Okay.
Now, my issue with Catherine is she has actually asked me to do other procedures, breast augmentation and recently a lip augmentation, and these are not procedures that are necessarily going to make her look better or make her feel better about herself, and that's why I turned her down for that.
And you said no. Please welcome Eric to the show. Eric, you're Catherine's boyfriend.
Right.
And you got to be happy with the doc telling her, forget it.
The doc is my buddy.
Doc's your buddy.
That's my buddy.
Explain how you feel about all this. This is the same woman that you've known for the last 3 years, correct?
Right.
She came into the relationship the same way, did she not?
She did.
How long did it take for you to figure out that she was this way in this relationship?
It took me probably about 2 to 3 months before I realized that there was more to it than just me thinking she was stuck on herself.
Okay, and then once you realize that, now you put up with it for the last 2.5 years.
Right, that's correct.
But right now, listen what she was saying. First off, she wants to go and get the Brazilian cardboard boxes stuck in her butt.
Right.
And believe me, they feel like cardboard boxes. You're gonna be sitting on cardboard boxes stuck in your butt. Girlfriend, it's not. They take these big plastic implants, like breast implants, right?
The problem with plastic surgery in patients with BDD is it can become actually a downward spiral. They have one procedure, they're still not happy with themselves, so they have another procedure and another one and another one. And each one, a lot of times, will actually make them look worse, not better. And this can even lead to depression and, unfortunately, even in rare cases, suicide.
Absolutely. Now, you know, we have, put Catherine's picture on this thing. This right here is called what? The what? Yeah, telestrator. Watch this. We have a telestrator. You guys get to see this. Because, Catherine, I'm looking at this now. If you could get Dr. Youn, if I'm going to tell you right now, if I and Dr. Youn had a conversation before the show, and I said to him, as long as you would not do anything from the chin down, that we might consider paying for everything you wanted to have done. So what would you do to your face now if you had to have it done?
The first thing I would do, but you can't see it.
Okay, draw on this little thing. Sure, circle it.
My teeth, because that's a legitimate, they're discolored.
Okay.
That's what I'm showing. And then I had talked to Dr. Youn about this before, but as you get older, like he said, your face starts kind of sinking in, and these lines right here can be injected with a couple, I'm not going to pronounce it right, I want to say Sculptra.
What could you put, what is it?
Sculptra, or sometimes people will use their own fat.
Or their own fat, and I would do that.
But Doc, and I'm not putting down plastic surgeons. I got a lot of friends who are very good friends of mine who are plastic surgeons, who've done a lot of work for the show, and I love you guys, and it's not. But don't you think, though, we've made this so readily available? Board-certified plastic surgeons are the only people I think anybody should go see to have anything like this done. But right now, you can go into a dentist's office in this country and have certain liposuction procedures done. You can go into certain other places, dermatologists who are not board-certified plastic surgeons, and have fat injected in your face. Unless you go to a certified plastic surgeon, you shouldn't even be bothering with this mess.
The problem, too, is that there are plastic surgeons out there who do procedures. They say, well, if I don't do it, somebody else is going to do it. And that's an unethical way to treat patients. The goal of a plastic surgeon is, number one, to be a doctor first. Number two, to be a plastic surgeon second.
Eric, I would think that Catherine's taking this aboard, because I asked her what you said you would do if, in fact, she had another surgery. She clearly knows that